In the news this week, lockdown intensifies as the Delta variant continues to spread in the eastern states. Dr. Andrew Miller says there's still a long way to go. A WAMN News exclusive.
Row 8 finally gone from the history books as the road reserve turns into a Class A reserve.
Homelessness crisis continues to plague Perth as demand for social housing is on the rise.
Plus the growing risk of lithium-ion batteries to your home as DFES warns of overheating risks.
This is the Evening News with Ivan Leung and Sarah Smit.
Good evening. Lockdown continues to tighten in the eastern states with hundreds of cases revealed every day. Meanwhile, here in Western Australia, we are shelved from the virus despite a very weak positive case detected earlier this week. So what's the best way forward for Australia? AMA-WA spokesperson Dr. Andrew Miller joined me earlier with this exclusive interview. Dr. Miller, thanks for your time. Cases in New South Wales continues to be high and Victoria is now in the middle of its 6th snap lockdown. The Delta variant is very hard to contain. What's the way forward?
Well, we need to continue to lock down when there's community spread to keep it as close as possible to zero until we have more than 80% of the entire population, including children, vaccinated. So we have to remain patient because, as we can see from the New South Wales situation at the moment, the alternative is much worse with having a lot of disease in the community, starting to fill up their ICUs, seeing, unfortunately, deaths as well, and trying to run out a vaccine program in the middle of that is very difficult.
So what do you have to say to Western Australians who are concerned about their loved ones in the eastern states?
The safety is pretty much assured for people if they follow the directions to lock down, remain isolated and just not come into contact with other people unless you're wearing a mask at the time. That really does make it relatively safe. Unfortunately, it becomes quite stressful if you can't visit over east when you need to. And that's the shame of when we have community spread of COVID. So unfortunately, they didn't lock down hard enough, soon enough, and now they're paying the price for that with what will be months of disruption.
Following a weak positive result this week in Perth, what should the Western Australian public be aware of?
There are things we can do while we're waiting to get vaccinated, and people should get vaccinated as soon as they possibly can, although we know that's not easy. Certainly, if you're over 60, you should take advantage of the AstraZeneca. The risk-benefit there is certainly balanced in favour of having the vaccine. And if you're under 60 and you get an opportunity for a vaccination, you should take it as soon as you can. But while you're waiting, you can also improve the ventilation in all your indoor spaces, get yourself a supply of N95 high-level masks, and be conscious that this is an airborne disease. And so if you need to make changes to your workplace, you should be working on that with your boss right now. So there are things that we can do while we're waiting, but we should certainly be supporting strong borders in WA because that's really our only trick. Our hospital system cannot cope with any level of COVID in it, certainly not any level of Delta in it. And unfortunately, of course, we will be seeing this disease more commonly arrive. We know that we have seen around 840,000 people turn up in Western Australia since the start of the year. So that's 100,000 a month. That's a lot of people. And so the odds of us getting Delta in here at some point, even though we've got pretty tight controls and we applaud those controls over arrivals from the East Coast at the moment, it's likely we'll have a leak at some stage.
So what are the priorities we need to focus on to get Australia out of this COVID Delta mess?
Well, we've got to concentrate on what's right in front of us, which is very low vaccination levels, certainly not the sort of vaccination levels that would lead to any kind of relaxation of restrictions. We can see that the UK is being punished, the US is being punished by Delta for going too soft on restrictions and assuming that levels of vaccination around 50% will be enough. Any suggestion that 50% vaccination is enough to reduce lockdowns, border controls and quarantining is false, unfortunately. And the real elephant in the room is the fact that we haven't vaccinated any kids. Virtually no one under the age of 16 is vaccinated, and certainly there's no plan to vaccinate anyone under the age of 12, and we know that these children can suffer and die from COVID. So until that's done, this is the life we're going to be living, and most people in Western Australia would agree that this is probably the best life to be living in the world at the moment.
The debate on Row 8 is finally over, with new legislation passing this week that makes it legal to build on the Belia wetlands.
It took 5 years of campaigning and a long legislation process, but the wetlands are protected forever. Reporter Brianna Melville joins us with more details. Brianna.
Thanks, Ivan and Sarah. The Belia wetlands are a loved part of the Cockburn community and are home to a long list of endangered species, including the Carnaby's cockatoo and endangered species of falcons and bandicoots. But this week, legislation passed in the Upper House, making the wetlands an A-class reserve. This means the area now has the highest degree of protection under our laws. It marks an end to a 5-year campaign to rethink the link, which has the support of more than 10,000 West Australians.
We weren't successful last term, but as I said, we took it to 2 elections and we had a mandate to protect the Belia wetlands for future generations, and that's what that legislation does.
The Greens have also long campaigned for the wetlands to be protected.
There were trees there that were 500 years old. Aboriginal heritage is clearly mapped going back 5,000 years in this place. These are significant places. You don't bulldoze and build roads over them.
Those who fought to protect the wetlands can now celebrate, with the Row 8 finally put to rest.
No community will ever let that happen again.
That's all from me. Back to you.
Brianna Melville reporting on that story. Thanks, Brianna. Demand is on the rise for more social housing in Perth as advocates remain frustrated at rising homelessness and deaths across the city's streets. 56 people died on Perth streets in the past year, with continuing warnings that the situation is dire, especially for First Nations people. Nelson Liu reports.
A humanitarian crisis hitting Perth streets. Homelessness described as distressing for the state.
There are families that should be in houses.
Juliet has been volunteering to help people who are living homeless. The retired nurse has called the situation horrific, especially impacting Indigenous people.
The bottom line is there literally aren't enough social houses. That's a big one. It's not the major cause, the only cause. We're living in a state that has a legacy of genocide houses. The other problem is the models of housing for Aboriginal people in particular are culturally inappropriate.
She's criticised Premier Mark McGowan's attitude towards calls this week to stop homeless deaths across the city.
It was like a massive slap in the face to grieving people, grieving families.
Juliet was at this homeless camp across the street from Parliament House that was protesting the lack of housing, but the camp didn't last long, police moving them on. Advocates claim there's a lack of commitment from the state government.
We are seeing no leadership from our state and our federal governments on the housing and homelessness issues in this state, and particularly here in a major city.
56 homeless people died on Perth streets last year, a vigil at Parliament House this week, highlighting the need for housing. The data came as Indigenous mother of 6 Alana Garlett died while sleeping rough outside the Wesley Church in Perth CBD in June. The McGowan government has this week unveiled the transformation of a city youth hostel into transitional housing, but concerns remain it's inadequate.
It's definitely not enough to at least the 500 plus that we see per night. I'm hoping that the service model is actually looking at wraparound services. So
Advocates say an investment from WA's projected $5 billion budget surplus is needed for more permanent social housing.
I think it's doable, and we just need that political will to make it happen.
Nelson Liu, WAMN News.
The McGowan government has announced a $4 billion splurge in health spending in the upcoming state budget, following long-running criticisms over the lack of nurses and doctors in the public health system. The announcements include the new babies hospital, health infrastructures, along with recruitment of workers. But stakeholders hope that less money will be spent on bureaucracy and more on patient well-being. And now here's a comment from Dr. Mark Duncan-Smith.
G'day everyone out there. Hope you're having a good time. We've had the $4 billion announced, but we think it might be a little bit hollow. We're concerned that the $1.9 billion, or just under $2 billion for the Women's Hospital, was already announced last year, and that was already money in the bank. So it's like promising something and then talking about when you actually deliver it and trying to claim it twice, but it's still only the $1.9 billion. If we then look at the other lot, $500 million for mental health, which is awesome, and then we got $500 million for COVID, that's awesome too, but that only leaves $1,000 million over 4 years for the health budget, which is only $250 million a year. Now that sounds like a lot of money too, but that includes operational as well as capital expenditure. So if we cut that in half, it's only $125 million a year to run the health department. Now that represents a 1.25% increase in budget, but unfortunately demand is going up by 3 to 4%. So what this looks like is we're going to see chronic ongoing underfunding of health, and unfortunately that means ongoing ramping and ongoing problems. So watch this space. Hopefully we won't see that, and hopefully we'll see that we'll get an improvement, but we do need to see the details of this, and we look forward to seeing that. So sounds good, $4 billion, but when you cut it down, it might not be that good. So we'll just wait and see. Have a good night out there. Ciao.
WA fire investigators are seeing a rise in the number of fires caused by overcharged household items. A Belia family home was destroyed in April when a dive torch that was charging exploded after the battery light failed to indicate it was fully charged. Household items containing lithium-ion batteries, including mobile phones and vacuum cleaners, hold the potential to overheat, causing a serious risk to lives and homes. It comes as WA enters its busiest month for home fires, with 80 recorded in August 2020.
The consequences is what we see here today. A fire starting undetected in a garage area where there's no smoke alarm, generating a lot of heat and escalating to the point where it's escalated into the roof space and then started other fires throughout the whole house. And in this case, we've destroyed the whole house.
New initiatives are in action to support Australia's skilled workers as a result of WA's Skills Summit. The initiatives to attract and retain skilled workers in WA will include mature apprenticeships, work to attract up to 5,000 onshore migrants to WA, and Indigenous employment opportunities. Skills Summits are set to be held in regional WA in the next 5 months, and the McGowan government says it enhances WA's commitment to training and jobs.
New York Governor Andrew Cuomo faced growing calls for his resignation after the state's Attorney General handed down its investigation this week. The latest development is that a former employee has filed a criminal complaint. It's understood that she was an executive assistant. So far, 11 victims have been identified as US President Joe Biden publicly urged Mr. Cuomo to resign. Meanwhile, the White House also said half of the United States population has now been vaccinated against the coronavirus. The number comes from the COVID-19 data director of the White House and means 165 million Americans have received 2 doses of the vaccine, including Moderna, Pfizer and Johnson & Johnson.
Now, you've all heard about the healing power of laughter, but a new bridge linking Perth Children's Hospital to Kings Park is providing young patients with the healing power of nature. The colourful $6.3 million Kids Bridge has opened to the public, providing an opportunity for treatment involving the park's natural environment. The McGowan government says it's a much-needed link between hospital patients and natural therapy.
Young, challenged kids in wheelchairs coming across here easily today, all of a sudden put into ancient bushland. I mean, how it's therapeutic for me, who's relatively okay. How therapeutic is it for a child and their family to just be able to breathe in the eucalypts and just be part of this magnificent park?
That's incredibly colourful indeed. And here's Darby with what's coming up on 6 News tonight.
Thanks guys. Tonight on 6 News, breaking news, more parts of New South Wales in lockdown as COVID cases continue to rise. Restrictions now tipped to continue for weeks as Gladys Berejiklian is accused of not imposing rules soon enough. Plus 6 million people right now in their 6th lockdown. Concerns grow about the latest virus outbreak in Victoria less than a fortnight after exiting their last one and just a few days after the anniversary of the state's 2nd lockdown. And he was the man who brought Sydney the news for decades, and right now tributes are continuing to flow after legendary Channel 9 broadcaster Brian Henderson dies at his home, aged 89. You can see the full details on all of those stories and much more on our YouTube channel. Just search 6 News AU. But for now though, it's back to you guys.
Thanks, Darby. And that's our weekly news and current affairs. We have the latest news on our website, wamnnews.com.au.
We hope you've enjoyed our company as much as we've enjoyed yours. From Sarah and myself, we wish you good health, good night. See you next Sunday.
Take care.